আমার নাম আঁখি, আমি রূপসা দক্ষিণ বাগমারায় থাকি।
আগে আমি মাছ কোম্পানিতে চাকরি করতাম। মাছ কোম্পানিতে চাকরি করা অনেক কষ্ট। ওয়ার্ল্ড ভিশন আমাকে উদ্ধার করে তারপরে আমাকে স্কুলে ভর্তি করার জন্য নিয়ে গেছে। আমার বয়স বেশির কারণে আমাকে স্কুলে ভর্তি করেনি। ওয়ার্ল্ড ভিশন আমাকে ট্রেনিং দিছে, লাইফ স্কিল বেস এডুকেশন ট্রেনিং করেছি, তারপরে ভোকেশনাল ট্রেনিং করেছি, তারপর ওখান থেকে মেশিন পাইছি, সিট কাপড় পাইছি। কাপড় দিয়ে আমি 3 পিস বানাই, মেক্সি বানাই, তারপরে ব্লাউজ বানাই, সায়া বানাই, পায়জামা বানাই। বাজারে মাস্ক পাওয়া যাচ্ছিল না, এমনিতেও গরিব মানুষেরা কিনতে পারছিল না, মাস্কের দাম অনেক বেশি ছিল। তারপরে আমি ভাবলাম যে আমি মাস্ক বানাবো, তা গরিব মানুষদের জন্য কম দামে বিক্রি করবো, তারা যাতে কিনতে পারে। যারা গরিব, অর্থ নাই, তাদেরকে আমি অনেক সময় ফ্রি দিয়ে গেলাম।
Good afternoon, everyone. My name is Christopher Devayakam, Senior Director of Operations for Strategic Support in Asia Pacific World Vision International. It's my great pleasure to welcome all of you to our inaugural Asia Pacific Child Wellbeing Learning Exchange this afternoon. The testimonial we've just heard is from Aki, our child beneficiary in Bangladesh. Aki is a former child laborer assisted by World Vision and currently one of over 5.5 million children receiving aid through World Vision's COVID-19 response programs. On a daily basis, half of the world's most vulnerable children here in Asia Pacific, like Aki, deal with harsh and challenging realities that place them squarely on the negative scale of life. The global pandemic, COVID-19, has exacerbated what was already a challenging situation for these at-risk children and their communities. The case for support to mitigate the devastating impacts of COVID-19 requires our attention today if there is to be hope for a better tomorrow. World Vision first started our work here in Asia Pacific 70 years ago. This learning exchange represents one of our many continuing startup efforts to give our children a voice, hope, joy, and justice, and more importantly, an opportunity to live life to its full potential. Today, we are very honored to welcome our esteemed speakers and panelists who have taken the time to join us in this global humanitarian discourse. They are truly representative of the diverse stakeholders who are champions for child well-being in their respective sectors. Thank you for journeying with us during these unprecedented times. It is our privilege to have Ms. Jean Gao, Regional Director of UNICEF Regional Office for South Asia, deliver this afternoon's keynote address. Ms. Gao, welcome, and thank you for taking the time to grace our e-plenary today. Next, my colleague, Ms. Lara Villar, Senior Director of Operations for Ministry Impacts and External Engagement for World Vision International in Asia Pacific, will share first-hand insights from our recently released report entitled Unmasking the Impacts of COVID-19 on Asia Pacific's Most Vulnerable Children, with a focus on the communities we serve in India, Sri Lanka, Nepal, and Bangladesh. This is followed by a presentation on the impacts of COVID-19 on nutrition and food security in low-income countries from Ms. Yoon Hee Kang, Assistant Scientist with the International Health Department at Johns Hopkins School of Public Health. Welcome, Ms. Kang. Moving on to our panelists today, we have Dr. Rinchen Chopal, who wears many hats, including Director General, Governing Board Member, and Member Secretary of South Asia Initiative to End Violence Against Children. Glad to be working with you again, Dr. Chopal. Next, we have Ms. Bhagyashree Dengle, Asia Pacific Regional Director of Plan International. Thank you for joining us. We are pleased to welcome Ms. Christina Anusha Alice, Head of Corporate Social Responsibility for Brandeis Sri Lanka. Great to have you, Ms. Alice. We're also joined by Ms. Mahmouda Rahman Khan, Senior Program Development Specialist and Gender Advisor from USAID. thank you for being here today. Last but not least, we are pleased to have as our moderator, Ms. Salma Khan, Senior Health Correspondent with the Singapore Straits Times, for this afternoon's panel discussion. Thank you for taking the time to be with us, Ms. Khalik. As we listen to today's presentations and panel discussions, please feel free to use the Q&A box for comments and questions which you may have for the speakers and panelists. We will do our best to have the questions addressed during our 30-minute Q&A session. Speaking of presenters, it gives me great pleasure to now invite our host for today's e-plenary, Mr. Cherian Thomas, Regional Leader for South Asia and Pacific from World Vision International, who will set the context for COVID-19 in our region for us, share the realities facing our vulnerable children, and what we can possibly do to rewrite the reality.
Thank you, Chris, for your introduction. Let me add my words of welcome to all our speakers, panelists, our panel moderator, and all of you, dear participants. Thank you for taking the time off today to be with us this afternoon. Before I set the context for today's webinar, let me make a couple of announcements. The first is, of course, to announce the signing of a regional collaboration agreement with UNICEF's Regional Office for South Asia. This was concluded last month without any ceremony, but we thought it would be very helpful to mention this on this occasion. We already have an agreement with UNICEF at a global level. We have agreements at various country and subnational levels. We thought that this would further strengthen the relationship with UNICEF in working together for the well-being of children. And Jean, we are particularly honored by your presence with us this afternoon. The second is about the Asia Pacific Child Wellbeing Learning Exchange. And this is an exchange for all of Asia Pacific for development sector players like us to be able to come together and to be increasingly market informed and impact driven in the way we undertake our business. The idea is that this platform will bring together research, data, impact studies, all centered around children and their well-being. So this webinar is the first of this series of the Asia Pacific Child Wellbeing Exchange. The learning exchange is really meant to really add value to the work that we do. And I really hope that as we move along, this will contribute very significantly to the cause of child well-being in Asia and the Pacific. World Vision, of course, is organized in a manner where the entire Asia Pacific region, there are 18 countries where we work, is divided into East Asia and South Asia Pacific, a little unusual when we look at the way regions are divided for the UN. But nevertheless, there are two of us, Terry Ferrari, who leads the East Asia region, and myself, Cherian Thomas, who would provide the leadership for this exchange. And we would really invite our peers and all collaborators and stakeholders in this sector to work in making this truly an interactive learning exchange for all of us. And now for the context, very clearly, we are seeing a very unprecedented time with COVID. We have not seen something like this for the last 100 years since the Spanish flu. And we have seen very quickly a health crisis being overtaken by an economic crisis. And simultaneously having to respond to the problem of health, while equally having to respond to the problem of livelihoods and economic development and health for children. So concurrently dealing with both the problems of health, the health crisis itself per se, as well as the problem of the larger impact that it has had on the lives of the most vulnerable children and their communities. And even as we, in a response, look very short term at what is tactical, it is important not to lose sight of what all of us are there for, which is how do we make a difference to child well-being in the long term and in the strategic. And that is why, to look at the strategic, that we thought it would be very useful to have this study, which was a rapid assessment survey for the countries that we work in. We have the results of 13 such countries which have been concluded till date. And what we have seen is that while we did the study primarily to inform us on how we should undertake our work going forward, how do we manage the dual problems of the pandemic and our development programming, and figure out how is it that we manage response and recovery simultaneously, we found that some of the results are quite striking. There are several issues that get thrown up through this study. The study is fairly large. It has over 36,000 respondents. It covers 9 countries. It covers 13 countries. And so it's quite critical because it gives us data that hopefully we can use to look at the larger picture and the larger scenario in these countries. There are issues of migration, of gender, of disability, of the urban rural elements in this whole crisis, how the remittance economy affects lives and families. There is so much that can be unpacked, and we do think that this is really the beginning of the journey. We also thought that it would be very useful at this seminar to also have a very unbiased and independent panel look at what we are presenting. And so as we present and as we deliberate, I'm very sure that some of the work that we do and the work that we showcase would clearly help us to exchange ideas, and many of the panelists and many of you participants might also exchange your perspectives, would be able to exchange your views on how things are, your experiences as well. And it would be a very rich exchange of views. It will be a very rich exchange of knowledge and experiences that we have, so that there would be collective wisdom as we move ahead. And so as we move on, I do really hope that our deliberations, the points that are made by our various speakers and panelists would really contribute to a very long-term discussion on the whole issue of child well-being in the Asia-Pacific region. Thank you.
That was Mr. Cherian Thomas, Regional Leader for South Asia and Pacific from World Vision International, setting the scene for where things stand for our vulnerable children and why we are here today. Thank you, Cherian. It's now my pleasure to invite Ms. Jean Gao, Regional Director of the UNICEF Regional Office for South Asia, to deliver her keynote address. Ms. Gao, please.
Thanks, Chris. Thanks, Cherian. Good afternoon, distinguished guests, colleagues, ladies and gentlemen from South, Central, and East Asia. I am honored to be gathered with you all today. Someone has their microphone? Okay. I am honored to be gathered with all of you today, partners from each corner of the Asia continent, and I hope you and your families are staying safe. On behalf of UNICEF and all partners present here, I would like to express my appreciation towards World Vision. The report presented today on masking the impact of COVID on Asia's most vulnerable children is a humble testament of World Vision's commendable efforts as an organization to constantly learn and to always strive to better understand the recovery needs of the most vulnerable children. The findings and recommendations of this report are fully aligned with UNICEF's recent report, Life Appended, How COVID-19 Threatens the Future of 600 Million South Asian Children. The evidence from both studies is clear. Asian countries have entered this crisis with many existing deprivations, and the measures taken to counter the pandemic are threatening to erase the crucial progress made towards the SDGs. This crisis is likely to reverse years, if not decades, of hard-earned gains achieved in child poverty, child protection, education, health, and nutrition. With COVID infections surging across South Asia, there could not be a more timely moment to highlight the impact that this terrible virus is having on children. The findings of both reports detail a perfect storm of consequences for children across a region that contains more than 1/4 of the world's population. Vaccination campaigns and other vital health services have been suspended. Measles outbreak have occurred in several countries, and other diseases are likely to follow. Polio eradication efforts have seen a setback. More than 430 million children are locked out of their classrooms. Some children can continue their studies remotely, but many in poor communities cannot. Confined at home, a growing number of children say they have been subject to abuse and violence. More generally, our staff in the field report that levels of anxiety among children are rising. But this is only the beginning. Families are being hit hard by the economic fallout of COVID-19, losing their jobs and seeing remittances from family members working overseas dry up. 500 million people in South Asia are already categorized as food insecure. And surveys shows that as income shrink, more and more families are being forced to reduce their food consumption. Our projections show that in the worst case scenario, the number of children in South Asia living in poverty could grow by half to reach 360 million in a matter of months. COVID-19 is affecting children in South Asia in all sorts of different ways. No one could have imagined the impact on children. Let me share with you concrete examples of what we are seeing across the 8 countries in South Asia. One of the most powerful means of hearing children's voice is through the various helplines that UNICEF supports. We have been seeing an increase of calls across the region. For example, in Sri Lanka, we have seen an increase of 40% increase in calls from children reporting abuse. Children are telling us that they're threatened. They want to report abuse, and above all, they're anxious about their future. They want help and support. So one of the things that need urgent attention is mental health. In a region where mental health is a taboo, all of us need to do all we can to scale up programs to help each and every child in need. In Bangladesh, in Cox's Bazar, where around 500,000 Rohingya children are living, despite all the work being done by UNICEF and partners to maintain service in camps and to reach them with information about how to protect themselves against COVID-19, they're still fearful. Surveys among Rohingya children shown that 64% fear getting infected and 48% were distressed because their child protection and learning centers are closed, and 39% fear they would die of COVID. This is a very strong call for reopening of schools across the region whenever it's feasible, because schools are a place where they can get help to manage their stress and fear for the future. We are seeing a reduction on demand and uptake of health services. This is a big problem across the region. For example, in Bangladesh, the average monthly consultations for children below the age of 5 in government health facilities before the pandemic was around 350,000. This has dropped in the month of May to 80,000. In Pakistan, immunization in major cities dropped from about 80% to 40%. Pakistan and Afghanistan are also key to the long-running efforts to eradicate polio, but immunization campaigns for polio and other diseases were put on hold. I'm happy to report that these campaigns have restarted last month in both countries. We must use our research to shape the discourse in Asia. We must highlight that not only the side effects of countering the pandemic have been damaging for children, but that there is also mounting evidence of long-term destructive consequences, which will affect children on a different scale entirely. Without urgent action now, the crisis could destroy decades of progress achieved in children's health, education, and protection. But perhaps contributing to the discourse is not enough. We have a role in changing the narrative for the most vulnerable children and adolescents. This crisis has presented us along with opportunities to expose and tackle the deep inequalities throughout this region. Our research must challenge the basic assumptions that inequality is an unfortunate byproduct of economic development and that it's something we must just respond to in times of crisis. Inequality is created on the basis of political choices, so our research and recommendation must guide decision makers in making the right choices. Bridging the digital divide for children and tackling inequalities in income, health, care, and social protection will require short-term measures as well as long-term policy measures, changes. Leaders in Asia find themselves at an historic crossroads, managing short-term pressure against medium and long-term uncertainties. As we enter a new window of opportunity to shape the recovery, or advocacy to prioritize children can only make a difference if we speak united with one voice. UNICEF calls on government to act now to protect those most vulnerable children. Two of the most effective ways in doing this are through emergency universal child benefits and school feeding programs. Such measures would help South Asian countries transition faster from the humanitarian crisis caused by the COVID-19 and move towards a more sustainable future, one which will have long-term benefits for children's well-being, the economy, and social cohesion. Among other proposals, UNICEF is calling for, one, the scale-up of low-tech home learning solutions, especially for girls, children living in remote areas and urban slums, and children with disabilities. Number two, installing adequate water supply, toilets, and hygiene services in all schools and all health facilities. We also want to highlight the importance of working with religious leaders and other partners to address the myths and hate speech surrounding COVID-19. Let me add that the explosion of virus is happening in high-density populated cities in India, Bangladesh, Afghanistan, and Pakistan, where people living in slums are at very high risk of contracting the virus. And children in these areas face multiple deprivations, from lack of water for hand washing, lack of toilets, lack of a space for physical distancing. They even face risk of going hungry. The very nature of the COVID-19 crisis called for a response that places cooperation at its core. We will only succeed in mitigating the worst effects of the pandemic if we break traditional silos and instead forge partnerships. There will be no recovery unless we work together to protect everyone, everywhere, so that no one is left behind in our even more connected world. We have a challenge ahead, so let's work together. Let's use our research to ensure adequate financing and push the reforms needed to address the huge inequalities that Asian children experience. A human tragedy is rapidly unfolding if we do not do nothing. We must act now so that children and their futures are not devastated by the aftershock of COVID-19. Hunger, disease, violence, and exploitation, and loss of education can be reversed if we all come together. I thank you and I wish you a very successful start of the Asia-Pacific Wellbeing Learning Exchange. Thank you so much.
That was most insightful sharing, Ms. Gao. Thank you for all that you and UNICEF are doing to help our children and communities here in Asia and around the world. Now, when the World Vision first responded to the COVID-19 crisis in China and then across geographies in Asia Pacific earlier this year, we knew that we needed a very solid understanding of what we were dealing with before intensifying our response. The situation was grim and escalating, and the data from our early recovery assessment report validated it. I will now invite my colleague and the leader of that report, Ms. Lara Villar, Senior Director of Operations for Ministry Impacts and External Engagement for World Vision International in Asia Pacific, to share key insights from our report. Lara, please.
Thank you. Thank you very much. Good afternoon. My name is Lara Villar, and I'm the Senior Director of Operations for Ministry Impact and External Engagement at World Vision. I will be sharing with you the findings of our rapid assessment, especially the findings around 4 countries that are part of the South Asia region, which are Bangladesh, India, Sri Lanka, and Nepal. All the findings are summarized in our report, unmasking the impact of COVID-19 on the lives of the most vulnerable children in Asia. As the background of this initiative, as you know, we are facing a global health and economic crisis unlike any other since World War II. But this is more than a health crisis. It is a humanitarian crisis, and Asia's children, especially the most vulnerable, are on the brink of severe malnutrition, increased disease, and significant risk of physical and emotional safety. World Vision began its humanitarian response to COVID-19 in China in February. And as the virus spread across the region and governments started to impose lockdowns, World Vision scaled up its emergency response to 18 countries in Asia where we have programs. To better understand the socioeconomic impact of COVID-19 on the lives of vulnerable children and their families, and to better inform the recovery journey ahead, World Vision conducted rapid recovery assessments across 13 countries in Asia Pacific. So let me first start sharing with you the summary findings of the 13 countries, and then we will nail it down to the 4 countries in the South Asia region. Please, can you move the presentation? Thank you. To the next one. Thank you. Next one. Okay, so this summary, the one before Rina. The rapid recovery assessment, as I said, it was conducted across 13 of the 18 countries where we work in the region, covering 402 communities and 35,927 people, including women, men, children, including girls and boys. And we also had some key informant interviews with faith leaders, government officials, and other community representatives. As I mentioned before, starting in May 2020, we conducted the rapid assessments, and we cover quite a large geographical area in our programs. This slide summarizes some of the key findings across these countries. Loss of livelihood is the biggest concern for communities in Asia Pacific. 69% of respondents have either moderately, severely, or fully lost their livelihood. Daily wage workers are the hardest hit. As a result of the loss of livelihood, families are struggling to meet their basic household expenses. Examples are 43% of respondents cannot afford their rent, and 42% of respondents cannot afford loan payments. Also, 60% of respondents cannot fully afford basic food supplies, and families are opting for cheaper, less nutritious food or less food, which is increasing the risk of severe malnutrition in children. There is a 19% reduction in the household average weekly food expenditure among the survey. Also, access to water and sanitation remains a challenge in Asia Pacific. We are behind the goals for the Sustainable Development Goals. And 23% of respondents, which is very close to the average in the SDGs across the countries, responded that they lack access to adequate water, sanitation, and hygiene for basic household activities. Access to health services has drastically dropped pre and post-COVID across the continuum of care, including hospital, community health services, community health workers, and other basic services. For example, respondents reported a 21% average increase in the gap of access to hospital services. Loss of livelihood is also forcing parents and caregivers to take desperate actions that are negatively impacting the well-being of children. Some of the main issues reported are 10% of parents and caregivers are sending their children to work, 9% are sending their children to beg or high-risk jobs, or 6% of the parents are sending their children to live with relatives. Finally, 20% of all children confirmed that caregivers are using physical or psychological punishment in the last 4 weeks. That is the summary of all the findings across the 30 countries. Now let us move into the next slide. And this is where we are going to share with you the key findings of the assessment in Asia, in South Asia, where we have programs in Bangladesh, India, Nepal, and Sri Lanka. Let us move to the next slide. This is the slide that summarizes our methodology for the rapid assessment. So across the 4 countries, we engage a total of almost 20,000 people, 30% women, 28% men, 22% girls, and 20% boys. 10% of the families have also people living with disabilities or a chronic disease. 22% of the sample is from Bangladesh, 58% from India, 9% from Nepal, and 11% from Sri Lanka. The assessment covers a very large geographical footprint across the 4 countries, with a total of 213 communities involved, where World Vision has current programs. We've used a mixed method assessment, including quantitative and qualitative primary data collected from parents and caregivers, children, and key informant at community level. The surveys and interviews were conducted in May, June, and July 2020, mostly by phone. And in some communities, we were able to do it face-to-face with the appropriate physical distancing. So let's move to the next slide, where we are going to summarize the themes of the assessment. So the findings of the rapid assessment are summarized in the following slides across the following themes: livelihood, food security, water, sanitation and hygiene, health services and essential medicines, and child protection. Let's start with the findings on livelihood. So the first slide on livelihood shows the loss of livelihood, which is severe. 77% of families reported to be the most important problem for the current situation, followed by food security, reported at 79% of all families. And then the third concern for communities is the access to medicine and healthcare, which is a major concern for 43% of all the families. The concerns seem bigger in urban communities, especially on what it relates to livelihoods, with 85% of all respondents, and food security with 84%. Let us move into the next one, where we show the different level, the pyramid of the people that we surveyed, and also the level of impact. So as you can see there, livelihoods of 77% of respondents have been fully or severely affected, which is significantly higher than the average across the 13 countries in Asia, which means that these 4 countries in South Asia have been really affected from the perspective of loss of livelihood. Daily wage workers, which are the largest segment in our survey, have been the hardest hit. 67% of respondents are daily wage workers, and 82% of them have fully or severely lost their livelihood. 24% of the respondents are farmers, and from those, 68% have fully or severely lost their livelihood. Finally, 9% of the respondents are people with salaries, and 65% have then also been fully or severely affected. Another finding is that the monthly average income of the respondents has dropped drastically. For example, in Nepal, monthly income dropped 86%. So from $199 a month to $27 a month before and after COVID. And in Sri Lanka, the drop is 82%, from $126 a month to $35 a month. Let's move into this one. This slide shows the movement restrictions have been the ones that have impacted the most on the loss of livelihood. So you see there around 76% of respondents mentioned that lockdown restrictions of movement and the link to transport limitations were principal causes of economic distress. Next slide. It's about the coping, our ability, the ability of communities to afford basic household expenses. And you see that that ability has been significantly impacted. So, for example, around 53% of respondents cannot pay the rent, and 59% of all respondents cannot make loan payments, indicating a significant dip in household finances. If households are not able to meet the rent, to pay the rents, they are in danger of being evicted and possibly a split of the family unit as members disperse to find adequate shelter. Such disruption, which is quite large in urban, creates quite a lot of stress for children and put them in unsafe or unsanitary shelter situations, which increase the risk of physical and emotional abuse. Not paying loans reduce a family's economic solvency and can lead to loss of collateral and increase the cost of future borrowing. The next slide looks at the community resiliency, and it shows that the community resiliency has been sorely tested, as 55% of respondents have borrowed from neighbors, relatives, friends, and around 39% have used savings to basic needs, and 38% have reduced the quantity and quality of their meals. In South Asia, Bangladesh is particularly concerning, as 70% are borrowing from neighbors, which is really high, and 59% are reducing the quantity and quality of meals. These coping mechanisms are diminishing core assets at the household level, thereby increasing the likelihood of children becoming malnourished and not accessing healthcare when needed. Community resources are strained as neighbors use cash to meet day-to-day survival needs instead of investing in productive assets. Across the sample countries, household assets are shrinking rapidly in terms of diversity and quantity, compelling households to employ livelihood coping mechanisms. Let's move into the food security findings. Only 30% of respondents, 23% in urban, are able to fully afford basic household food supplies. In addition, the average weekly household expenditure has reduced. The reduction in quantity and quality of meals is particularly worrisome in urban communities, where respondents reported a 23% reduction in their average weekly food expenditure. The drop in average food expenditures points to the impact of COVID-19 on the reduction in food intake because of less affordability of food, a consequence of livelihood loss, and less accessibility due to the lockdowns imposed and limited transportation availability and affordability. This is particularly worrisome, as even before COVID-19, the levels of malnutrition in South Asia were already alarming. Asia and the Pacific regions account for well over half of the world's undernourished, nearly half of a billion people, 486 million, as per UNICEF statistics. Statistics further reveal that 59 million children under 5 in South Asia were stunted, or in other words, severely malnourished. So this is an increased risk to severe malnutrition for most of our children in this region. Next one, to cope with the lack of affordability for basic household food supplies, 56% reported relying on less nutritious food, 41% are reducing the portion size, and 38% of respondents are reducing the number of meals a day. Next one. So let's move now into the next section, water, sanitation, and hygiene. So as mentioned before, over 25% of respondents do not have access to adequate water for drinking, cooking, and hygiene needs, which increases the risk of waterborne and infectious diseases and child malnutrition. In Bangladesh, the lack of adequate water for household cleaning and hygiene is particularly high at 51%, and hand washing at 48%, especially when we look at the global pandemic and the need for water for prevention. While 75% of respondents confirm that hygiene supplies were readily available in the market, 79% found this unaffordable. If people do not have access to safe water for essential food and hygiene needs, there is an increased risk of waterborne diseases. This fact, paired with increased lack of food, access, and availability, contributes to significant challenges with child malnutrition. Lack of access to clean water also increases the risk of child protection and gender-based violence, as it is women and girls who are most often tasked with sourcing water for daily cooking and hygiene needs and must travel longer distances to obtain water. The farther they travel, the higher the risk of gender-based violence. Let's now share the findings related to access to healthcare and medicines. Access to basic healthcare has drastically decreased pre and post-COVID, increasing the risk of maternal and child mortality and morbidity. As you can see there, access to hospital services has decreased by 29%. Access to community health centers has decreased by 32%. Access to maternal centers has decreased by 24%. And access to outreach services has decreased by 17%. In Sri Lanka, 47% of families with children below 5 years couldn't access maternal and child health services due to reasons such as unavailability of transport. Most of the respondents indicated they had access to hospital and community health centers or clinics before the outbreak, but since the outbreak, access has decreased largely due to lockdowns, either because people are unable to access transport to the health facility or because health facilities have limited operating hours so that health staff may arrive home before curfew. Key informants in India highlighted that as of May 2020, health services were concentrating on COVID-19 and other emergency cases and were only providing limited access to non-emergency services, including vaccinations and antenatal checkups. Respondents also indicated that the reduced income, the cost of services and transport, and their fear of contracting COVID-19 from other patients also contributed to their reduced access to health services. On this slide, we see the previous one, that 48% of respondents confirmed essential medicines were readily available in the market, but 69% of them found them unaffordable. So you see that accessibility and affordability are both issues at this point for access to essential medicines. Let's move into this one. 93% of respondents confirmed that they have adequate and regular updates and information about COVID-19. Main channels are television and radio, 70%, family, friends, and relatives, 42%, and social media, 35%. Let's move into the last section of the report, child protection. Loss of livelihood is forcing parents and caregivers to take desperate actions that are negatively impacting the well-being of children. In this slide, we see that 9% of children are being sent to beg or engage in high-risk jobs. 9% are being sent with relatives. 4% are being sent to work. 3% are being sent to institutions, and then 1% is at risk of early marriage and 1% at risk of illegal activities. So the economic consequences of the lockdown are increasing safety risk for already vulnerable children and are pushing those on the brink into deeper vulnerability. Key informant interviews also include reports of online exploitation, neglect, and child trafficking. The loss of income, reduced access to school, and changes to children behavior during quarantine contributes to increased levels of severe stress in community. This slide looks at the different elements of mental health or injury or physical illness, and you see that 22% of respondents indicated to have suffered severe stress over the last 4 weeks. And also the number of mental illness, 7% are reporting mental illness. The levels of mental illness correlates with the expected amount of mental health needs in a community, but the rise of severe stress at 22 of respondents is really a concern. If you look at the number in Bangladesh, over 44% of the respondents experience high levels of stress. This, as you know, affects productivity, children's ability to learn, cohesion, and health in the household. Final slide. The increased stress on families contributes to an increase in the physical and emotional abuse of children. As you see there, 51% of parents, caregivers indicated that they are unable to handle changes in their children's behavior, which increases the risk of children's physical and emotional punishment. 24% of children reported experiencing abusive language and scolding from their parents. 25% of parents indicated that they have resorted to physical punishment and emotional abuse in the last month. And this number is even higher in urban at 41%. Finally, 68% of children in India reported that their parents have used physical punishment or psychological aggression over the last month. When parents are unable to handle their children's behavior, especially with heightened stress levels, they tend to use physical and psychological aggression to maintain perceived control. Also, a significant portion of key informant interviews reported an increase in alcohol consumption within families and a rise in disputes among couples witnessed by children and elderly family members. Respondents mentioned that the rise in abuse and violence was due to the stress of lockdown measures, the loss of jobs, and school closures, which have resulted in families spending more time together. All of these have contributed to families raising fears about their security, health, and future. So this is the final slide of the summary of our report from our rapid assessment in South Asia. Thank you very much for the interest and for the passion to improve the lives of the most vulnerable children. Thank you very much.
Thank you. Thank you, Lara. It's humbling to know that we have the opportunity to impact the lives of millions of children, not just in India, Bangladesh, Nepal, and Sri Lanka, but across our region and the world. Now, moving on to how things are viewed from beyond our development sector, I'd like to call upon Ms. Yoon Hee Kang, Assistant Scientist with the International Health Department at Johns Hopkins School of Public Health, to share the impact of COVID-19 on nutrition and food security in low-income countries with a focus on Asia. Ms. Kang, please.
Yes, okay. Can you hear me now?
Yes, I can. Thank you.
Okay, yeah, thanks for the introduction, Chris. And it's great honor to be part of this wonderful seminar today. And many thanks to World Vision Asia Pacific. So yeah, let me start my presentation. With the increase of COVID outbreak in low and middle income countries, the practical concern of global society is how the lockdowns and economic recessions due to COVID-19 will affect existing and ongoing international efforts for children's survival and thrive. Thus, now I am going to review some results of mortality estimation studies and current data related to the impact of COVID-19 on food security at global level with a focus on the Asia Pacific region. International Food Policy Research Institute suggests that even short lockdown measures combined with severe mobility disruptions and moderate level of food system disruptions lead to an average 7.9% decrease in GNI per capita relative to the pre-COVID-19 projections in most LMICs. A microeconomic model projects that this COVID-19 related predicted economic loss is associated with 14.3% increase in the prevalence of moderate and severe wasting among children under 5. And the percent increase corresponds to additional 7 million wasted children. More than half of the wasted cases would be found in South Asia. UNICEF prospects that the coverage of essential nutrition service will have 30% reduction in LMICs. Particularly, lockdown context will be affected severely with a decline of 75 to 100% of the essential services. Even with an average of 25% reduction in the coverage of essential nutrition and health services, the increase of the prevalence of wasting would lead to child deaths of 128,000 in the year of 2020. Another mortality estimate came from a recent study published in The Lancet by Robert Netter. Using the Lives Saved tool, the research team suggests 3 scenarios of reduction in the intervention coverage and estimated child and maternal deaths. The scenario 1 indicates 5% reduction in the coverage of essential health and nutrition services, and the scenario 2 indicates 10% reduction. And the worst case, scenario 3 indicates the 25% reduction of the services. In each scenario, they project that the proportion of wasted children would increase by 10% in the scenario 1, and 20% increase in the scenario 2, and 50% increase in the scenario 3. This table suggests that even in the least severe scenario would result in 253,000 additional child deaths and 12,000 maternal deaths over 6 months. The Sub-Saharan Africa and Asia Pacific region struggle existing structural vulnerability and food insecurity. Although lesser extent of structural vulnerability is seen in the Asia Pacific region, some countries have already high number of population at risk of food insecurity. Furthermore, this precondition would be aggravated by COVID-19 this year. In the year of 2020, global GDP is likely to contract by 5% to 5.2%. Globally, the number of people experiencing acute food insecurity will almost double to 270 million, including 121 million newly food insecure due to COVID-19. This indicates a 82% increase compared to the number of acutely food insecure before COVID outbreak. Almost 42 million in South Asia and 9.6 million in Southeast Asia are projected to become extreme poor due to COVID-19 this year, which will be compounded with pre-crisis levels of food insecurity and malnutrition and disrupted food systems. Afghanistan, Nepal, Timor-Leste, and the Pacific Island countries are the most at risk due to high dependency on food imports and remittances, as well as a drop in revenue from exports. In Afghanistan alone, nearly 3 million additional people may experience acute food insecurity. Bangladesh, Myanmar, Pakistan, India, Sri Lanka, Cambodia, and Laos also are likely to be severely affected by lost incomes and livelihood. Another information source prospects that COVID pandemic will put 452 million population at risk of job loss in the food system area, and 1,090 million at risk of food system livelihood. Out of this, about 20% of population in the primary production will be affected. However, the affected scales are more tremendous, as much as 60% in the food processing, food service, and distribution services. Climate change will add more threats in the Asia-Pacific region to the effect of COVID-19 on the existing food insecurity. Many countries in the region would struggle flooding, cyclones, or drought in the middle of an increase of COVID infection this year. In LMIC settings, school meals has a lot of meanings. School meals help children to increase school attendance and have good nutrition for growth potential. The school meals also function as a social protection from any abused situation. Currently, 161 countries closed school, where 346 million children are missing out on school meals as well as education opportunity. Most of the countries in South Asia and Southeast Asia have at least 1 million children missing on school meals and education. Now I would like to introduce some country-level data of World Vision's COVID-19 early recovery assessment in Bangladesh. So this survey assessment was done among 2,460 World Vision sponsored household and other households in the country. Out of them, almost 60% experienced lockdown for 41 days on average. About 1 out of 10 respondents lost jobs or experienced salary reduction in the past 2 weeks. 66% of the household had no food stock at home, and 39% of adults and 59% of children had only 1 or 2 meals in the past day. It is notable that most of households reported movement restriction as a main reason of livelihood disruption. Also, we can see food system being already disrupted in the country from this data. At least more than 2 out of 5 respondents mentioned that there is no market to sell products and livelihood inputs are too expensive. Another rising concern is the shortage of some essential items. Fresh foods and hygiene items and essential medicines were not available among more than 20% of respondents. Unavailability of basic food items, such as rice and flour, was lower than other items relatively. However, this situation could be deteriorated over time without urgent responses. So already, global society has unfolded various short and midterm strategies to reduce the impact of COVID-19 on nutrition and food security. It is estimated that a minimum of $2.4 billion is needed immediately to protect children, prevent and treat malnutrition, and avoid human loss. Given the prospect of a high increase of child wasting, we need to scale up nutrition services for wasting prevention and treatment. Also, we should expand social protection, particularly for vulnerable groups, including nutritious diet and essential nutrition and health services. To reduce the impact of COVID-19 on food insecurity, it is suggested that we need to supply food distribution in the short term and enhance food production in the medium term through input supply and irrigation, and also need to strengthen critical commercial food supply chains. These actions should go together with appropriate guidelines to protect frontline workers and community people to prevent COVID infection. Also, continued monitoring efforts to track the impact of COVID-19, particularly among vulnerable populations, are recommended. So far, many thanks to all of you for listening to my presentation. Thank you.
Thank you, Ms. Khan. As we listen to each of our speakers today, it's clear that there are multi-layered issues facing vulnerable children from whom World Vision serves in this region, and how many of these issues require multi-layered solutions. Speaking of solutions, this would be a great time to bring on our panel. And I also would urge you to type in your questions on the Q&A box, and we will have a separate time after the panel. I will also call upon Ms. Salma Khalik, Senior Health Correspondent with the Singapore Straits Times, who will moderate this afternoon's discussion. Over to you, Ms. Khalik.
Thank you very much, Christopher. We have just heard some really shocking data. COVID-19 is a tragedy and it's killed a lot of people. But what we found out today is that the fallout is far, far worse than that. It has also caused a humanitarian crisis. With us today are 4 members of the panel, experts in their own field, and let's find out from them what their take is. Anusha, could I start with you? You've heard what the speakers have said. What is your take on their findings?
Hi, everyone. Thanks, Salma. Yeah, like you said, it's not very good news when you see these numbers, especially when Jean said that there is a 40% increase on abuse of children in Sri Lanka. But trying to be positive, I think and I pray that there is a light at the end of the tunnel. And if you look at the work that most of these countries have done, and most of the companies and the NGOs and the government, you can see that, I mean, we were hit with something which we never expected. In the first few months, I think we were finding it difficult to find our way, but I think now we've kind of realized where we have to go, and the work that World Vision Sri Lanka has done immediately as soon as COVID hit and we could actually go out, or the essential services could go out, the stuff that they've done was fantastic. From a company point of view, you know, I work for a garment industry, and we've been, I think after tourism, we've been one of the worst hit industries as well. Most of our production floor associates have lost at least 70% of their income. We managed to keep their basic salary, but their overtime, their production, their efficiency incentives were all had to be cut, because obviously for a few months our production stopped as well. But what we did was we looked at the pain points, and I think it was covered in Lara's presentation as well, where she was talking about livelihood, she was talking about household expenses, she was talking about and Ms. Kang spoke about nutrition. We looked at these three. These three were actually our main pain points, and what we did was we looked to see how we could help our most vulnerable employees, and then we deep dive even further, and we paid attention to their children. So in terms of nutrition, in terms of education, what we did was we kind of took over that kind of expense of theirs. And when we opened the factories, we provided them, of course, we provided them the 3 meals that we usually do. But in addition to that, we provided them the opportunity of buying family packs from our welfare shops at a very, very minimum rate, which is deducted from their salary, so that they didn't have to have cash in hand to pay. Apart from the fact that you couldn't have cash in hand, they didn't have, it just got deducted from the salary. So what we did was we looked at providing them secondary income. So we gave them training, because most of them are single income earners, and the ones whose spouses or mostly their husbands who are casual workers. So what we provided them was with the ability to get a second income. And this second income not only allowed them to sell their product to get the income, of course, but also to help their own consumption of vegetables and stuff like that. So those were the 3 main things we looked at. And we also looked at, which I found was very unique, and I think we took advantage of the relationship we have with our banks in speaking to we did a survey on our financial situation of most of our associates, majority, and we spoke to the banks and we got them certain concessions. We got them to redo their loans, and we did small things like that, which kind of we felt would definitely help them, help their current situation. And I think it helped, because we see that now that we did that much, there's some more requests coming as well, because they know that there is a possibility of us helping as well. And for the kids and for the female associates, we opened up this helpline, because we got a set of counselors with us, and we opened up this helpline, anonymous, of course, to call in. And we have counselors who sometimes go to the houses and visit these houses where they have very, very vulnerable children. So those are the things that we did from a company point of view. But having said that, there are lots of challenges. But like I said, hopefully a light at the end of the tunnel.
Thank you, Anusha, for giving us some pretty good news in the light of what we've heard earlier. Can I now turn to Rinchen to get his take on what the speakers have told us earlier? Rinchen, over to you.
Thank you very much. As always, I'm so overwhelmed with the presentations and the figures that were presented. And also the gravity of these figures, because behind every single digit, there is one face, one individual that we can never really imagine or fathom the type of impact that single individual is, suffering. Now, the presentations amply demonstrated the magnitude of the crisis this COVID pandemic has brought in. I don't think there has ever been, as Chris said, after the Spanish flu, such an unprecedented humanitarian crisis. And the impact on the lower socioeconomic vulnerable group of populations brought or built in a separate crisis within this overall crisis that whole humanity is grappling with. Now, for me, since I'm in constant dialogue and touch with my colleagues in the 8 countries, particularly the civil society networks of CIVAC, which we call NACGs, there are a few things which I thought may be of interest for us to find out. One is, when we are talking about, whether it is health care, education, whether it is food, whether it is jobs and other things. One of the areas which is beginning to have an impact in terms of our response, and probably a significant impact on the recovery, is the type of community cohesions or traditional community support systems, which have become significantly fragile with passage of time. And the family bonding with, all this migrant and overseas workforce who are just distant providers, the type of struggle single parents have with children, and also the type of impact we saw, the painful impact we saw of migrants trying to come back home, has significantly affected both the mental, psychological, and the dignity of individuals, which I think is tragic for humanity as we move forward. So I think that has, in a way, directly translated into some of the more painful stories of suicides that are taking place in many of our countries. And that again contributes to the impact of the pandemic. So that is one area as to how society's ability to cope with a crisis like this needs to be measured. This, I think, also relates to me, and particularly because SIVOC's mission is mainly to keep governments and institutions on the table as we address child rights and violence against children. How is the response to the pandemic by the governments or the political institutions, both at the national and at the local level? How are they able to provide support so that this, vulnerable segments of our population, at least there is some basic amenities that keep them, moving forward or keep them going from day to day? I think measuring that and also trying to, as we move forward, strengthening the accountability on the table, and need to, receive the due, focus. I think the child rights community and the WAC community needs to build our advocacy and our lobbies to ensure that, the governments and state institutions and local bodies actually gear themselves to ensure that the type of response and the recovery strategies are targeted properly. Now, besides, because of the time factor, I think I will bring in one more issue. As we move forward, and as the presentation on the nutrition factor has been made, I think the closure of schools, missing of that single midday meal, and its a long-term impact in terms of the health and nutrition and ability to keep children in school, I think has been one of the most drastic impacts of the COVID pandemic. And this actually is going to be the factor that is going to create a generational impact on our recovery phase and how humanity is going to be impacted by this pandemic as we move forward. And in terms of the response, one of the things that I was looking for was how were we able to bring in or rope in children's and young people's groups and networks to actually help themselves in their own, not just in bringing in elements of their own peer group protections and support and surveillance systems, but also create a larger mobilization of such psychological support among their groups, so that they are able to cope up with this, prolonged lockdowns and restricted movements, and also the impact of family violence and abuse and exploitation. And maybe as the discussions go, it may be good to focus on some of the key push factors that will impact on children as the pandemic moves forward, as the recovery phase slowly sets in, as economies open. My biggest fear is that children will be made to bear the brunt of turning the wheel of the economy, the tender shoulders of the children, either as cheap labor or given for child marriage or, sexually abused and exploitation, either trafficked. So there are a lot of other factors which will bring in more deeper issues as we move forward. So let me end here and then see how it goes. Thank you.
Thank you, Richard. You've actually raised a very pertinent question when you asked, what can governments do? What should they do to help? And I also like the way you said it's also time for the community to get together to try to help each other. Now, before we go deeper into that, let's see what the other panelists have to say. Can we turn to Bhagyashree? Could you tell us your take on this subject?
Thank you, Ms. Kalik. And first of all, I want to thank Cherian and World Vision for inviting me and want to congratulate you for this report. I think it has come in very, very timely. And it's a very, very useful document for us as civil society organizations, because it not only brings evidence to us, but it also endorses the urgency with which we need to respond as civil society organizations. And so the previous panelists as well as the presentations have talked about various issues, right from nutrition to child early forced marriage, school closures, economic impact, etc. But I would like to highlight here one of the key issues that we have seen in Asia Pacific emerging, and also that is endorsed in the UNFPA's report, that because of this pandemic, the impact it has had on the livelihoods of families. Many families are using child early and forced marriage as a coping strategy. And we have found those incidences being reported in the countries where we are working. And I think as civil society organizations, we need to really look at the root causes, because there has been immense effort that has happened over the past few years to address issues around child rights. And while children's rights are being violated because of this pandemic, girls are even more affected. I mean, that's our observation. And what is it that we need to do to further accelerate the effort? Because it's going to really take us a few years back with all that effort we made to get the most vulnerable children in school, or the health of young people, and also prevention of child marriage. So this is a moment where we really need to take stock, work together in a collaborative effort, because we are going to need more resources and efforts to ensure that we are able to address these violations. The second thing that we have observed through, I would like to mention here the work that we initiated some time back, because while we respond, it's also very important to listen to children and young people, and particularly girls. So we published this report called Hear It From Girls, and we reached out to thousands of young girls across Asia just to listen to them about how this COVID pandemic has impacted their lives, and how they would like us and the governments to address some of the issues that affect them. And please feel free to look at that report on our website. And so the girls would also like us to focus on some of these key issues like child early and forced marriage and gender-based violence. The number of cases of domestic violence that have been reported in many countries across Asia, and that's also being presented by the presenters earlier, it has not only doubled, but in some countries there has been 300% growth in reporting of domestic violence. And these are areas where again we need to collaborate and work together and address. So I would like to thank you once again, and maybe I'll bring other points and the recommendations later if I have the opportunity. Thank you.
Thank you, Bhagyashree. And let's turn to our last panelist. Mahmuda, could you give us your take on what we've heard so far?
Sure. Thank you so much. And I'm really honored to be part of this great panelists and presenters. I think I'm getting shocked every day with a lot of information coming on the COVID. So this is another way we can see that both of the presentation, and congratulations to both the presenters for this holistic presentation, which covers health, food security, water and sanitation, livelihood, and gender-based violence, and which is also the USAID focus as well. I just want to highlight that when we actually looking at this COVID situation, and as you know, that both the presentation finding out some of the key data from Bangladesh as well. We have the Amphan, and then we are having flood now. So it's like a triple burden of disaster, you know, and the COVID together on people, men, women, and children. And I just thought that. I was just thinking about the adolescent girls when we saw the first video. In the flood affected areas, people are actually having lack of water, do not have enough water for drinking, and think about their menstrual hygiene, you know. So that made me think about that, goes back to their health issue again. So this is so interconnected that what can we do to ensure that these girls actually have a pure access to maintain their menstrual hygiene. The other thing that struck me that, you know, we are talking about the gender-based violence. At some point, we also talked about how child are being abused. But the other point in Bangladesh, which is not very often talked about, sexual abuse of child within household. And this is a time when people are all at home or the shelter, not enough space to move around. So, you know, how can we be more careful about thinking about those issues? So that struck me a little bit more. And I was just thinking, how could you address that issue? And people are losing their income. Many migrants, women and men are coming back. They are losing their livelihood, not enough food at home. Nutrition is another challenge. And I just thought about, so many people are doing the virtual session. But think about in Bangladesh, women do not have access to digital technology. So that's another kind of layer of deprivation from the gender perspective. So we have to actually take all this account, that how we can address this holistic approach and who is doing what. So there, and having known about this from USAID, we immediately after the COVID redirected some money to actually address some of these water and sanitation issues, the hygiene issue, and the food security issue. Recently, the US ambassador also started an initiative through WFPA to actually distribution of food to the urban areas. But also it is important that though we are doing that, are we actually giving them enough nutritious food so that they can maintain their nutrition? Oftentimes we give them rice, lentils and other things, but we have to be very thoughtful in terms of how could you actually ensure the children nutrition in the food package as well. How could you ensure adolescent girls menstrual hygiene within that package as well? Our humanitarian assistance immediately start distributing all kind of relief to the flood affected areas and the Amphan areas, but there is so much needs to be done, you know. And oftentimes as a development practitioners, we consciously or unconsciously get siloed. You know, we do not actually have a coordinated approach. We need to connect the dots, and you know, the government, the civil society, the donors, the UN, all have to work together and complement each other. And I think that how can we ensure that? That's a big challenge, a big question to me. And I think, and there is a great need to think about how could you address the GVV. And I think we are talking about a whole lot of negative things about COVID and Amphan, but this has also struck me that this is an opportunity. People see that gender-based violence is not an isolated issue. It affects every sector at any given point of time. And COVID had taught us that it is actually increasing even within this pandemic. So this is will be food for thought on the table, that how people can see that gender-based violence could be actually addressed different sectoral intervention. And this is also USAID is one of the I think advantage, that they have the policy and they have integrated that in each of the activity, how to address GBV on the ground while doing health, food security, water and sanitation, democracy and governance. So that's, I think this is a food for thought, and I just want to put on the table to hear from other people how people actually think about the GBV and sexual violence is not an isolated issue in development, is actually cut across every sector and have an impact and overall in the economy. I should stop here. Thank you so much.
Thank you, Mahmuda. And thank you for highlighting that the gender inequality is actually magnified during this time.
Yes.
Now, before we open to questions from the audience, and I hope the audience is sending in questions, I'd like to ask each of the panelists, going forward, can you give me one suggestion of what you think can be done now to help, and one suggestion of what can be done after the pandemic is over to try to bring things back to normal? Could I start with Rinchen on this? One suggestion on what you think is the most important thing that should be done now and what should be done when the pandemic is over. Rinchen?
Thank you. Since it is very specific, for now, I think ensuring that we are able to reach out, basic essential services to ensure that people are able to live from day to day, even if it is very minimal. I think that is probably the most crucial one. And it is important that the child rights and WAC community and everybody who is out there ensure that there is a coordinated approach to make that possible for those who are, struggling under this massive human tragedy. And also to ensure that, there is an ability to map out or monitor how the communities are able to adapt or live with this crisis for now on a day-to-day basis. But moving forward, to me, at the end of the day, I think, as Jean also mentioned in her closing, I think, remarks in the presentation, there is a definite need for the child rights and WAC community to actually find opportunities to converge our strategies, to collaborate with each other, try and do away or avoid this siloed, compartmentalized type of activities, and continuously go out there competing for scarce resources, while our focus should be in terms of addressing the needs of the target population. And while we do that, and if you're able to do that, we will also be in a position to, lobby and create more effective lobbies and create better accountability and monitoring of the governments and political institutions who are the duty bearers, so that they are also able to organize themselves better with, much more support and confidence of, working together with the child rights and WAC community. I think that is what is needed now, instead of looking at isolated opportunities of moving forward. The time, actually, the call of the time is for a collaborative, convergent, strategic move forward. And I think that's the only way we can move forward effectively if we have to address this pandemic recovery phase much more effectively.
Thank you, Richard. So greater cooperation and less working within silos. Can I turn to Bhagyashree now? What do you think is the one most important thing that can be done now to help, and what should be done after the pandemic is over? Bhagyashree, over to you.
Thank you. I think one of the things we must keep in mind is that COVID-19 must not compromise or reverse the commitments and progress made so far on child protection. Protection needs of children and girls must be at the center of COVID-19 response. While we are responding to various community needs, we must keep child protection at the center and inform and guide policy systems and other interventions from that child protection lens. We must also ensure that children, girls are meaningfully consulted and are included in the decision making, because it's very critical to listen to them, because they are the ones who are impacted. How are they affected? How should us be addressing their concerns and issues? I think that lens is very critical. And also going forward, most of these interventions have to be done now, and we have to continue doing. So one of the things is like strengthening national and regional laws and policy frameworks to protect children from violence, and ensuring that those laws and policies are adequately resourced and implemented. So these are very critical in order to address the child rights and gender equality, in my opinion. Thank you.
Thank you very much, Bhagyashree. Can we now turn to Mahmuda for her take on this? A very quick one, because we are running out of time.
Okay, so I was just wondering that since you asked one quick point, many people are actually covering many things. While we are actually distributing food, I felt from the nutrition point of view, as Bangladesh children are suffering from stunting and wasting, it seems crazy whether we can actually serve prepared food to ensure their nutrition, for the children, because we don't want to actually lagging behind on this issue. Secondly, I think it is important also to see that whether we can support the local organization to ensure the people who need the food or relief or support get it, because we are hearing a lot of news that people are that relief are not reaching to the right people. The way forward, there has to be, I think it is very important, it could be done now or in future. It is important to transfer the asset, like the cows, goats, or poultries, because oftentimes microcredit institutions started doing the loan, which is not helpful for getting people out of the poverty. And thirdly, I just want to actually strengthen the local government, strengthen their wing, so that there are accountability, and they can actually work with the civil society and the NGOs to make sure that the development actually having in their community and having a sustainable impact.
Thank you very much, Mahmuda. And now to Anusha, give us your take on this, please.
Yeah, so I had collaboration on top of my list as well, because this is a fight that is affecting everyone, every level equally. So I think that's something that needs to happen, and needs to happen fast. But since that was already spoken about, another point I had was we need to have our ear to the ground. We need to actually look, and we have to listen and see what the actual problem is, without a lot of assumptions, without a lot of hearsay. Just actually find out what is happening in the homes, what's happening to these children. Are they getting, even if they're homeschooling, are they getting the right education? Are they getting the right nutrition? That, for me, I think right now, that's one of the most important things. And as for the future, I think technology should no longer be optional. It everyone has to have access to information, so that the children could be educated. I mean, technology is a must, I feel, every household. I know it's a huge, ambitious target, but I hope it happens.
Thank you, Anusha. Ambitious targets are important. Yeah. Right. We have time only for a couple of questions. Could I ask Christopher, are there any questions from the audience? If there is, could you please post one now, please?
Yes, there are a few questions. The first one is for Mahmuda. How do you think donors would respond? Unlike in the past crisis, donor countries are equally affected by the crisis. How do you see future trends in terms of grants and donor funding for some of the issues raised?
Right. Will funding continue after the pandemic because the donor countries are also affected? Who would like to take that question?
I think it was directed to me, and we haven't seen any kind of. I know in general the donor funding is shrinking for development. That's for true, and even in USAID actually moving towards journey for self-reliance. Whether we want the host country to be self-reliant, but when there is a pandemic like this, we haven't actually seen any kind of cut of the donor funding yet, though the host country is affected by themselves, but the foreign policy hasn't affected yet. So I'm not very negative about it. I'm still hopeful that for this pandemic, many of the donor countries will consider, despite their own affection, because it is coming from the taxpayers' money. So people are paying tax, and the money will come, and then people will actually consider funding this the country which are more affected. Does that help?
Yes, that is actually very good news. Does anybody else have anything to say on this subject? If not, I'll ask Christopher for the next question. Christopher, could you read out the next question, please?
Yeah. This is directed to Mr. Choppel. Have the initial lockdowns resulted in a reduction in child sexual abuse because children and families were homebound? Do you expect an increase in child labor, child marriage, child sex abuse, and trafficking once the restrictions reduce? If so, what can governments and NGOs do together about the issue?
Right. Again, protecting the vulnerable. Who would like to take that answer? That question, sorry. Gayatri, would you like to take that?
Is that directed to me?
Yes, it's directed to
Dr. I guess since the substance of the question seems to be central to SIBOC's mission, as I said, I'm in constant, contact with my NACG colleagues in all the 8 countries. And there has been also significant reports, both in mainstream as well as social media, that, the push factors of the COVID pandemic, which is being referred to as a crisis within a crisis, on the impact on violence against children. And there has been phenomenal increase in the area of child sexual abuse and exploitation, particularly online exploitation. And, there are increasing reports of child trafficking, increasing reports of child marriage and child labor. And I think this is what I was referring to as the economy is open, as the pandemic's recovery phase starts, and as the travel and tourism industry opens. You see, children, unless and until we are careful in terms of our surveillance and monitoring and our responses to address the violence against children, children will be the segment that will be affected significantly as we move forward. So this is something which requires a little more time for elaboration, but due to limitation of time, I can confirm that there is a phenomenal rise in these areas.
Right. Thank you very much for raising that issue. And I hope everyone who is involved will keep an eye out for that and to make sure it does not happen. I think we have run out of time. Christopher, I'm passing the entire session back to you. Thank you.
All right. This one is for Jean Garb. A recent UN paper estimates that the crisis will pull down about 400 million people back into poverty, below US $1.90 per day, $1.90 per day. What are the large macro measures that UN bodies and governments can do?
Is that question for Cherian instead of for the panelists?
It's for Jean, I thought.
Is Jean on the line? Jean, could you answer that?
She's not.
Chris, I think Jean has gone off the line.
Oh,
She
okay.
She's
probably
not
has
there.
dropped out. Yeah.
Okay. I have one last question, and then we can move on. The violence against children in a domestic context is concerning. Across Asia, the challenge is both cultural and almost endorsed by a lack of policy around it. In the short to midterm, do we really see any solutions to this problem?
Anyone see a solution to a problem that has existed for centuries? Rinchen, perhaps you would like to take that?
Yes, we, even the pre-COVID time, South Asia, as Jean said, we actually have not just 1/4 of the world's population, but we also suffer a huge burden of violence against children. And the COVID pandemic has, created a significant, exacerbation of the challenges related to children, violence against children, particularly in these areas. Now, what discussions, online discussions with my colleagues, civil society colleagues in the countries indicate is that there is a need now to focus on community and local body strengthening and community, support systems and cushioning, and also reach out to young people and children themselves to be able to, address this, and then need to work with law enforcement and other child rights and civil society actors to be able to respond to this. But this is an area which must be, underlined, and we need to work with the governments to make sure that the response in these areas must stay as a priority on the table of the governments, as well as all the child rights actors and community members. Thank you.
Thank you very much, Rinchen. Now, I have to thank all the panelists for the very information, and pass this session back to Cherian for his closing remarks. Cherian, over to you.
Yeah, thank you very much. And I must say that well begun is half done. And we have, in that sense, been off to a good start. The whole pattern of how we discuss matters and discuss issues in a webinar format, in a virtual exchange format, has really changed our lives and in many ways made a difference. And there was this whole issue about technology that came in. And using technology, despite many of our limitations, is something that many of us have very, very quickly adapted to. But what does technology mean for the most vulnerable? What does technology mean for the most vulnerable children? That's ultimately something that we need to really apply our minds as to making sure how can we make technology work for them, particularly as many of them are unable to attend school at this particular moment. And I would just pick up on a couple of points that that were made by our panelists. For instance, Dr. Chopel talked about collaboration and cooperation. And I think in many ways, this learning exchange is a good start to this whole area of facilitating coordination, collaboration between players who have long-term interests in this sector. And I really do hope that what I said, that this well begun is not is half done, does not remain just half done, but it is something that we would love to work with other partners, with other stakeholders, and we would really welcome stakeholders in this sector to join us in this entire effort. The other point that Bhageshri had mentioned about how we need to be well informed and to be able to look at some of these issues very, very critically with data, with research. And I think, again, this learning exchange can give us an opportunity to present some of the findings that each of us have through various studies. It's therefore about breaking silos, not working in silos, but clearly as organizations coming together, pooling resources, pooling information, so that the whole process of programming going forward would be very, very carefully informed, and would in one sense be something that is very thoughtful, so that we really make a difference to people. And of course, the last point that Anusha had made was about having our ears to the ground is important. It's very critical. And I think for an organization like World Vision, which is in one sense very vertically integrated, we have our staff living in communities, we have our ears to the ground. And I think this kind of data is real data, which really gives us the confidence that a lot of what we are doing is actually making a difference, a real difference to the most vulnerable. And so we have come to the end of our Child Wellbeing Exchange, and I really must thank all our speakers, our panelists, our moderators, our friends from the media, and all the participants for taking so much time off and being with us this afternoon. I think it's been a great start, and we really hope that we will continue with this going forward. The recording and the relevant resources will be made available. I know there was one of the questions which came up in the in the Q&A platform. It came up rather late, and I think that was why it was not picked up, about the whole impact of climate change. And we've just concluded together with UNICEF, with PLAN, and with Save the Children, a study on hearing children and children's voices on this whole issue of climate change and how it will affect them. And that can well be one of the future subjects that we discuss at an exchange going forward. So we intend to continue with this. We intend to keep going forward. And we really hope that all of you will stay tuned and be available for further meetings of this kind, which I think will go a long way in having a very vibrant and a responsive group of civil society working in partnership very closely with government in looking at some of the most critical issues that have been thrown up, whether it's livelihoods, whether it is access, whether it is protection. Being thoughtful, being better informed is for us the way ahead. So thank you all very much. And again, really appreciate the very active participation of all of you. See you next time. Until then, goodbye, and may God bless you. Thank you.
Thank you.
Thank you, Cherian.
Thank you very much.